We okay, so a very flustered Keith, a cool and calm Robert's kept his wits about him. And we'll just have to do this live, which is a shame. I was looking forward to the sort of easier version. But anyway, I have far too many people to screw it up for you folks, so we don't want to do that. So now we're on a slideshow, and we're going to be talking about the new Avazia Pinnacle. It's not quite so new, it's been out a few months, but it's it's still it's a brilliant unit, a brilliant advancement. Listen, those of you who know the full story, you know that my interest in this goes back to the days of the scanner and the Russian thing. The newer devices now are so amazing with so many programs, and this Pinnacle is the pinnacle of microcurrent therapy. Well, we're going to explain what that means for you shortly anyway. That's just a nice, warm and friendly picture. Now, those of you who don't know me, who's this idiot that's blundering around? Well, it's me. My name's Keith Scott Mumby. I'm a British trained physician, live in Las Vegas, basically, but you'll have heard I'm currently in the south of France. And it's not looking good. This is not what you think of when you think of south of France. It's lousy weather outside the window. Never mind. I've been a medical, alternative holistic doctor for a long time. But we're talking now with the family of the Hashays. Rob is the son of this family. Well, one of them. You're just a son, aren't you, Rob? Basically, that's yeah. Mom there, and Pop. John has. What shall we say? I think he's got his own slide, hasn't he?
I don't know if we did slides. No. We were all together.
No, we didn't. I think you did it all together. Yeah. Anyway, John Hashay was the sort of pioneer figure. I mean, I say was. He's still alive. I'm not trying to write him off. But he, for the reasons you now understand, he was not planned to be with us tonight, or the lovely Lorraine, because we thought we had it covered. Ah, well, technology lets you down. That's what technology does. Anyway, Rob is the young activist in the group, and he practically runs the show now. He's a technical wizard, an online genius, an internet marketer, whatever you want to call it, all of those things. And to be honest, sometimes I have to ask him questions myself too. So good on you, Rob. And this is Van Bergen is his mummy's. That's Lorraine there. That's her what's it called? A maiden name, pre-married name. So that's why he's not called Rob Hashay. Okay, so Rob, I want you to take over as many of these as you can. First of all, you created them, so you know what you had in your mind at the time. But I don't want to hog the thing, so I've just sort of talked a bit to get it going. But this is really the contrast to conventional medicine, isn't it? What we taught and what we think is true basically isn't true, and what we're told can't be true. There's no way that could work. Actually works very well. So do you want to get going for that?
Yeah, absolutely. Yeah, I think this is where we kind of get into this, and a lot of people are very familiar with the conventional way of doing things. But the truth is, as you say, we're taught that this is the way we should be. But most of us from childhood, we grow up listening to doctors, and we're told that there is no answer to our issue, or there is a chemical answer to our issue. But regardless, when you get sick, you're given something, whether it's a pill or whether you need surgery or whether there isn't anything that they can do. Their system is very stifled and stuck in these old ways. And I think, this is where we kind of move through this here. So whether it is anxiety,
well, it just basically doesn't work, does it? That's why you have to take the pill again next morning and the morning after. Okay, Camilla just raised her hand. Let me just repeat the caveats I've said. We're not going to do questions and answers in the middle. It will interrupt the flow. And goodness knows I've stumbled on this, and it's my fault, but we got it flowing again. Let's flow. But also, Camilla, we might answer your questions. So please just be patient and just sit tight. If you're still there at the end, you still want an answer and it's still not something we've covered, then of course we shall help you, dear. Okay, so this is, the same message, isn't it? Do you mind if we speed up a tad?
That's totally fine with me.
It's not going to hurt, is it? This is your slide, talk us through it really, but basically it's saying what I said, which really doesn't work, which is why you take them 3 times a day, twice a day, once a day. It's because it doesn't. My definition of a cure, is very cruel. It means no symptoms, no disease, no treatment. That's a cure.
Right.
It's gone. You don't need nothing. It's gone. And we can do that with this device. Come on.
Yeah, absolutely. I think then this is the problem, right? This is what we've been saying. This pill is all it's going to do. These pills that we're given is kind of lessen the pain and discomfort. That's the good thing, but it's not really good, because on the bad side of things, it's going to create more problems. It's going to shorten your lifespan. It brings so many side effects, and even like can kill your organs off. So ultimately, it's just, as John says, it's allowing you to degenerate in peace. Right? You're keep breaking down.
Doesn't stop you degenerating, but you don't notice anymore.
Yeah, exactly.
Until you're suddenly an old crock and the medicines weren't protecting you at all. It's pathetic, isn't it? And of course, surgery is somewhat the same. I mean, it's a more permanent solution. If somebody's taking your knees out and replace them with stainless steel, you're not going to have any more pain in your knees. But it's a pretty lousy, clunky solution. It's not one I'd look forward to, I think, certainly.
Yeah.
And of course, there are many complications of surgery. People, from 60 onwards, it gets more dangerous. From 70 onwards, you really shouldn't do it unless the person is in an emergency situation. Too many risks for being put out under an anesthetic.
Yeah, absolutely. And I mean, long term, we're going to talk about scar tissue a little bit later in here, but the creation of scar tissue will lead to more issues anyway. So even when you get that shiny new knee, the scar tissue that is created in them putting that in is huge, and it's going to have a heavy impact on the body a year or two later.
Right. Okay. Oh, right. Now, what I'm finding is our little thumbnails are obscuring my view. Oh, it's just another version of nothing we can do, isn't it? Nothing we can do.
Pretty much, yep.
Yeah. And so the inference, of course, the stupid inference is, therefore, there's nothing anybody else can do. They never say, nothing we can do. We're useless. We haven't a clue how to fix this. Why don't you go and see a chiropractor or get yourself an Avazia device? You never get that part of the story. So we want to change this, right? And
we do, yeah. I think, rather than accepting this as a fact, which is what a lot of people have done, we want to just flat out challenge it. Because the truth is that you can resolve these issues without drugs, without surgery. Most of the time, if not all of the time, there is something we can do.
Right. And it's Mother Nature that's the healer.
That's right.
Doctors don't heal nothing. The best they can do is get out of the way, set the stage and get out of the way.
Yeah.
The body's designed to heal, isn't it? Like you slice a bread knife through your thigh. Ow, that would hurt. But you hold the sides together for a couple of weeks and it all stitches itself back together. That's what nature does. She's brilliant at resolving things. She's a wise old thing. And so what we are choosing to do, of course, is back nature's method, isn't it? Anyway,
it is,
so talk us about inflammation. This is probably the number one pathology in the human species is inflammation. It's to blame for almost everything, actually.
Yeah, it is. And I mean, like even the conventional medical system will say that over 80% of all chronic disease, illness, and pain is because of inflammation. But the truth is, what I've seen over the years, and I'm sure you can relate to this as well, is that inflammation is the root of all disease. Whether even when we're looking at depression, even when we're looking at dementia and Alzheimer's, there's inflammation involved in this process.
Right. Diabetes, cancer, arthritis, arteritis, meaning, your heart attacks and strokes. These are all inflammatory processes. Not good. Yeah.
No, not at all. And it's this inflammatory process is like wrecking the whole body, right? And it's sticking around too. When people get into this chronic inflammatory state, they are contributing, or their body is contributing to the breakdown of their body. And it's this inflammation that's supposed to be a good natural part of Mother Nature's healing system that helps us to heal an acute injury, that then keeps going, that does the opposite. And there's not really an effort made to deal with that inflammation. It's seen instead as a marker of disease, but it's not seen as that root that we should take care of.
Yeah,
Yeah.
exactly. Have we got one of the sort of dashboard slides coming up, you know, the car?
Oh, I
Well,
think
yeah,
we,
no, we've got it here, haven't we? Oh, no, we're something like that. Anyway, you put your happy face on, but behind it all, you're going to hell in a handbasket, basically.
yeah. Pretty much, yep. It doesn't really matter what you do, right? Like you're taking something to mute the pain, to mute the inflammation. But really the inflammation that's signaling this pain to you, underneath it's burning away and it's doing the damage in your body. It's that you're degenerating in peace. You just don't know it. And we need to be able to move past that. We're just not, people are not looking at the inflammation as a root the way that they should be.
Right. Well, one of the classics is diabetes. You know, you go to all this trouble and you tweak and you take insulin maybe, or you adjust your diet and you keep your blood sugars. It doesn't make a ha'porth of difference. You still die 15 years earlier on average. It's all a bit of a hooey and waste of time. So healing blocks, inflammation blocks healing. Explain that.
Yeah, I mean, it's impossible to regenerate when inflammation is in place. It's meant to initiate the regeneration process by coming in, causing pain and protecting you so that you know that whatever you did that just caused you pain is something you should stop doing. And then it starts to initiate that healing process. It brings in the immune system. It does all of these things. And then after that, it's supposed to turn off. And then the body can start to repair itself. But in these cases of chronic disease, the inflammation is not turning off. It is sticking around. But when we mute the inflammation, when we mute the pain, we don't know it's there. So we forget it's there. We forget we're in pain and we trick our body into forgetting about it. And while we do this, the fire of inflammation is still ravaging our body. We just don't know it. By the time those medications, those things that we're taking or doing to mute the pain wear off, we're going to be in a far worse state than we were when we got into it, because that fire is going to have spread.
Right. Definitely, yes. So, well, this is better than the car dashboard warning light. Let's do it this way. Same message.
This is the youth version of the car dashboard warning light. Yeah, this is how I describe it to people, right? Like, we treat our houses often far better than we treat our bodies. If you were to walk into your bedroom and your bed was on fire, you would not close the door and walk away. I mean, you might close the door and run away and call a fire department, but you're not going to just say, huh. But
well, you're not going to close the door and say, oh, it's fixed. It's no fire anymore.
Exactly. I can't see it, so it's not there. That's what we're doing when we mute the pain, when we mute the inflammation. We're closing the door, but that doesn't mean the fire is gone. We don't have to look at it. It's still there. No one would do this. We would not. I cannot even think the most insane person would leave their room on fire and walk away and think everything is fine. But so many people do this to our bodies. And I think it comes back to this concept that we were taught to do this. We've been raised to believe we are not the healers. Our bodies cannot heal themselves. But, you know, it is a big, big problem and something we commonly see. And this, I think, kind of highlights that. It's the same as you say as the dashboard warning light, right? Just putting a piece of tape over it. Now your check engine light's not on anymore, but it really still is.
Yeah. All right, just a quick announcement. People are joining us all the time, Rob. Thank you for coming, everybody. We were a little flustered initially, but I think we've got it under control now. We had a recording playing, didn't work, so we're back to live, no problems. All I want to say to those of you who joined us late, I'm in the south of France, and Rob is almost the other side of the world. He's on Vancouver Island in Canada. Ain't technology marvelous? Well, it is when it bloody well works, which isn't always. But we will deal with questions. That's a promise. And you've got a choice. You either type them in the chat box. What you do is go down to the bottom of your screen and hover, and a bunch of icons will appear, one of which says chat. It's like a little cartoon Zoom box in which they put words, and that's supposed to be somebody speaking. The other one is the Q&A, stands for question and answer, of course. Either of those choices, type in your question. It will remain till the end of the presentation, and we will deal with it as soon as we've got through the main flow. What we don't want is to keep stopping and sort of bump along just because one person has a question. Save it till the end, and then we promise we'll answer it, even if it well, if it hasn't already been answered, we will answer it. All right, press on, Rob. We've lost a little bit of time there. Let's try and get back to being efficient.
Yeah, so I mean, this is what we've been kind of building up to, and I think we've been more direct than we normally are. But essentially, the answer here at this "why are we not healing" question is that if inflammation is the root of all disease, then all we need to do is shut down the inflammation, and we cut power to the disease, and people will start to recover.
Yeah, I concur with that. Absolutely. So a bit like flipping a switch. It's a nice graphic illustration of what we're doing. Click, the inflammation goes away. But I don't think we need to dwell on that slide otherwise. Now, this is where it starts to get subtle. We're using a technology, a very modern, wise technology, using electronics, devices and things, which we will explain. But the essence of it is that we're talking to the brain, aren't we, Rob? We dial up the brain and say, hello, we got a problem down here in level 17. Can you fix it with us?
That's right. Yeah. And I think this is where we get it. This is where we really start to differ from what is becoming more commonly known in microcurrent as this frequency specific microcurrent, where they have these big machines in clinics and they dial it up and they wrap wet towels around you. Like these devices, those frequency specific microcurrent units, they're not conversing with the brain. They are putting frequencies into the skin. This is a huge deal because this allows us to use this technology to work with the brain, which is in control of our body. It is the thing that controls our healing system. And we use this through a feature we call dosing and zeroing. And the simple 5-step process, realistically, is these frequencies enter the skin. Because of the voltage of the device, which is just push, it's nice and gentle tickle, it pushes the frequencies into the skin so they can hit the nerves and they travel up to the brain. And the brain will actually respond and talk to the device. It'll ping it back, and the device tracks this. So it will let you know what is going on in there. But then you've got that loop. It's like you're dialing up the brain and saying, hey, my arm hurts. And the brain says, oh, right, I'm on it. And the body and the device and the brain can work in tandem to fix the issue.
Right. It's very funny. It's great when the brain pings back. Hello, anyone? Anyone at work today? I used to have this, well, it's not a joke. It was quite a serious comment, but I used to have a saying that, every home should have one of these devices in the medicine cupboard. It can do almost anything, fix pains, sprains, cuts, wounds, infections, tonsillitis, bellyache. There's some things you wouldn't use it directly and mainly for lung cancer, for example. That's not to say you can't get some use out of it. But, in the medicine cupboard, you can deal with all kinds of things, often without a pill or without an ointment or salve or anything else. Just run this electronic device over the area for a while and it recovers. So my saying was, every home should have one. And it was a joke from an old movie with Britt Eklund, and I think it was Marty Feldman. And it was an au pair girl. Every home should have one. All hell broke loose in that particular household. It was a comedy film, but it's always stuck in my mind, although it was in the 1960s, I think I saw it. Okay, so why was this device? Now, we know we've been getting bigger and better, haven't we? The Russian scanner was good. It was a miracle in its day. I did some amazing work with it, and I know you and your mom and pop did it. But it's just got better and better. And now we have an American manufacturer and production quality. We've got American standard guarantees and repairs and things. So they're much better now than they were. But you've gone on tweaking and improving this device. Why? When is good enough not good enough?
Well, that kind of really comes up a lot. And it took us a long time because every time we brought this up with Avazia, we worked, and you've helped us launch both our Avazia Life Genesis and our Avazia Life Evolution over the last few years, both home units, right? We had this Pro Sport 3, which was the top of the line. It was the best we had. But every time we talked about making our own, the response was, well, we can't add anything to it because it's full. Luckily, technology improves, and this motherboard, we were able to get better motherboards. And so it was important to us, essentially, that we had everything that we currently had, and we're able to add more. So we had to have this big meeting and these several meetings to see if we could load up this device with something and make it better. And we've ended up adding all sorts of different things to it, including several automatic treatments. Because if I can say there's one thing that there was a problem with the Pro Sport 3, was that it was hard to learn initially. There was a lot of overwhelm.
Because it was so powerful, yeah? I mean, it just did everything. It would make tea or coffee for you if you asked it to.
Could, right? Yeah. And people would wonder, they would say, what do we do with what do I do with this device? I've got all these options. But this is really, we've really used this ability to rebuild this device to add more to it, keep everything people were used to before, but load it up with automatic treatments. And this has become, the beauty of this is 6 minutes of treatment is enough. And you can apply the device and it will change modes. It will adjust to your body's resistance. It'll do all of this stuff by itself. And then it will say, treatment's done. And you can turn it off and you can walk away.
Right. Now, you mentioned Avazia without saying this is an American corporation in Texas. You know, we're talking American manufacturer. In fact, I think I'm right out in saying these are the dudes, the electronic wizards that used to do Texas watches, and they switched, and they're now doing medical health and healing devices. So these are pretty full-on clever guys that work with and for the Hashes to go on improving this all the time. Okay, so, well, I think you explained this, didn't you? You want you want more without sacrificing anything you already had.
Exactly. And just that final point really is the important one. We wanted to eliminate that learning curve for home users that was seeking the power of a professional unit, because a lot of people wanted the best of the best. You want the Cadillac, right?
Yeah.
Well, if you want the Cadillac, you know, there was a learning curve, but there is not really anymore.
Yeah, so if you can drive a lawnmower, you can drive the Cadillac now. Huh?
There you go. Yeah.
Something like that. Okay, tell us then about the technology. All of these devices, I haven't got mine to show you. Anyway, all of these devices look similar, but they all each have a different name and each has a different function. And as I said, this is the one called the Pinnacle.
That's right. Yeah. And I think in these next slides, I break down each of the new things we added, as well as we go through all of the different features and things it can accomplish, because there's a lot. So we'll try and keep a brisk pace, but we want to be informative and let everyone know all of the things. So we can skip to the next slide.
Talk fast then.
Right. Okay. Oh, I'm already going to slow down. No, vagus nerve stimulation.
It is the next slide. Yeah. Okay. So you dive right into the most complex. I think actually a lot of people have heard of vagus nerve stimulation. It's a way of inducing relaxation, calm, and anti-inflammatory. It has to do with the parasympathetic nervous system is the calm and quiet one, and the sympathetic is the flight or fight. We don't want that. We want to turn that off and go into parasympathetic mode. Well, the biggest parasympathetic nerve in the body runs down your neck, and you can stick the electrodes on it and go bzz, and it doesn't hurt, by the way, but you just go bzz, and you're stimulating the vagus nerve. Now, it's all the buzz now. If you put in vagus nerve stimulation into Google, hundreds of thousands, if not millions of people are doing it, including some big names, like Bessel van der Kolk, who's professor at Harvard. He's fully embraced it in a clinical situation, and he travels the world now teaching vagus nerve stimulation. Over to you, Rob. I'm sorry. Go on.
No, yeah, no. It's
interrupted a bit.
It's a passionate topic and it's big. I mean, this is what I did my dissertation on, and it resolved. It was looking at kind of like this broad spectrum concept of anti-inflammatory, like let's turn off inflammation. And whether it was any inflammatory disease, lots of digestive issues like ulcerative colitis, Crohn's disease, these big things that are very impactful on people's lives, all these inflammatory levels would get turned off, and people would resolve their pain, but also resolve the other issues in the body. So not only is it relaxing you and putting you into, as you say, this parasympathetic state, where you're actually calm and relaxed and your body is able to initiate healing, but it's also, in doing so, blocking production of inflammation in the body. So the inflammation stops being created, which will in turn reduce and eliminate your pain and then allow the body to heal. So this treatment by itself has been one of our biggest developments over the years. And it is still something that is included in every single protocol for anyone that is dealing with any form of chronic disease or chronic pain. Right. And it only takes about 3 to 12 minutes a day, depending on how much of it you need.
Yeah. Okay. So, well, explain the other lot, the orthodox doctors, they're on this. The reason is simple. They know it works. It works. We're not pulling your leg. It works. But their idea is cut the neck open, stick a stimulating electrode on the nerve and clamp it on, and it'll go bzz, bzz, regular several times a day, and that will work as vagus nerve stimulation.
Yeah.
But the big snags with that, tell them.
There are. Yeah. I mean, you're doing the surgery. For one, there's a cost. I think if you click the arrow there,
the next one.
It's going to come up with a few there. It's got all the risks and costs of surgery. I think it's about $30,000, and they only last about 5 to 10 years. And after that 5 to 10 years, you're going to have to go in and have another surgery and replace it. And yes, these are constantly stimulating your nervous system. What I do not like about this compared to our stuff is it's going to override your body's natural ability. What we're doing is we are training the vagus nerve to react normally. Eventually, you will not need to keep doing vagus nerve stimulation. But if you have an implant, you're doing it all the time. How is your vagus nerve, your vagal tone, ever going to change if it is being trained consistently that it doesn't have to do any work anymore? And this is where we kind of go in for these short treatments, and then we take a break, and short treatments and take a break. And this is the way of the future, because we don't want your body to become dependent on this. But this, of course, $20,000 every 5 years, they want your body to become dependent on this.
Of course they do. That's the standard business model.
Yeah.
Doing it our way. Yeah, go on.
Yeah. And this is what you said, right? Like you essentially take your device and you apply it to the neck, and the vagus nerve passes right down there, and it just takes about 2 to 3 minutes. You feel a little like jiggle on your neck, you're in the right spot. And we either use the Y electrode or we use the conductive pad that we included in the kits. And you can just stick a pad, like a little sticker, on your neck, and then you go hands-free and get on with what you need to do while it stimulates.
Have you got a Y probe on your desk there?
I don't. It's out there with my wife. I wasn't prepared for this.
My fault, folks. For those of you who joined late, I was going to do play a recording. It didn't work for some reason. So we jumped on live, very unprepared. But Rob, as you can hear, is very knowledgeable. He's not going to be flustered. He knows his stuff. He's one of the masters of this machine. Yeah.
So onto neurofeedback. This is, I'm sorry, these slides require a bit of clicking, I think, to bring up the points. This is where we look at these different brain frequencies. Our brain operates between about 7 hertz and goes up to about 45 hertz. So we can help sleep, we can help anxiety, we can help depression, PTSD. There's an option for everything. In this device, you have the waveforms of your alpha, beta, delta, theta, gamma, which are your different brainwave types, and all of the different things they do. And through just clipping these ear clips to your ears, you can actually put these frequencies across the brain. So you're sending it point A to point B, it's passing through your head, and it's actually going to alter the brainwave frequencies, and it will shift your brain into these different modes. So alpha, sleep and relaxation and calm. Gamma actually is a state of the brain which is being seen to actually help reverse dementia, because it's clearing out the plaques in the brain. So for health of the brain, we want to be able to go into these states. The problem is, and this goes right back to the inflammation at the beginning, when you are in a chronic state of inflammation and pain, you are in beta. You're in your fight or flight mode. And then your brain doesn't have the ability to shift into these healing modes. So you don't sleep properly because you're in pain. You then don't get your deep sleep, which means your gamma does not kick in, which means you do not detox your brain, which leads to brain fog. It is all interconnected. Being able to speak the brain's language and maybe be a little bit tricky and trick it into changing its waveform is kind of essential to resolving some of these chronic issues.
Right. Now, you said something that might be a bit scary to some people. You know, you're changing your brain, it doesn't sound very natural. But in fact, if I point out, you know, if you listen to some beautiful music, some Beethoven or Mozart, that will change your brainwave frequencies. You'll go towards the alpha end. If you watch some war drama or some of the modern Hollywood stuff, you know, blood and splat everywhere, that'll move you in the highly stimulated direction. You are naturally changing your brainwave state and conditions all the time. So it's not creepy or weird to deliberately go for the sleep and relaxation one.
That's right.
Just wanted to make that point. Okay. Oh, that's just more of the same thing that you were saying, isn't it? All right. Now, this is a very big part of this kind. We call it microcurrent therapy. Tiny little current. You can hardly feel it. You've got to turn it up to feel even a tingle, but to feel unpleasant, you'd have to whip it right up. You don't need to do that. So one of the things that we encounter in microcurrent therapy is the trouble caused by scars. Take it away, Rob.
Yeah, so scars are our rule number one. The first thing we're going to get you to do, unless you're in extreme pain, so we do have a few exceptions, if you go ahead and join the family here, is you will be working on clearing your scar tissue. This is because scars, they will create a communication blockage. So when your brain tries to send an electrical signal through your body to trigger, say, let's turn off inflammation, a scar will absorb some of that signal and distort what it's saying. This will not only create pain and inflammation, but it's going to impair the ability for the body to heal. Because as these communications fail, the signals will either try to find another path or they will just get lost completely. And these scars will actually absorb so much electricity that I think it's like about 100 times what tissue should normally experience, that they will kind of fill up and then they will pop. And you'll get pain spasms, you'll get all these other issues that are coming up, but then it won't go away. They'll keep absorbing it again. They'll start over. So what we need to do is, with a simple treatment of just going over the scar tissue with the right frequency, we can neutralize the electrical barrier and we can allow the communication to function optimally again, so the body can start to send signals. Beyond that, it'll also even flatten and remove the scars. So if people are trying to, if they are uncomfortable with how a scar looks, or it's really painful and tight, you can actually break it up. And with something we've done with the Pinnacle, it's different with our other devices, is we've included what we call damping, which actually helps the current go further in certain modes to deal with like big surgical scars. So like hysterectomies, for example. Lots
internal
of
scars, you mean? Yeah.
Internal scars. That's right. Yeah. But it is our first go-to rule. It's very, very important, but also very simple to treat.
Right. Okay. Back to inflammation. This is where it really, really scores.
Yeah, it is. And you've got your vagus nerve for your systemic inflammation, but if your shoulder hurts, you can treat your shoulder. If you know, wherever you're experiencing this pain or your swelling or this redness and heat, this is a spot of inflammation. You can go there with the device, you can put it on the skin, and you can just work over the skin, and it will actually remove that inflammation. It'll break up those inflammatory pockets in the areas.
Right, and it might need a few reworkings, but basically we're talking about permanent change. We're not talking about pill popping where it keeps coming back every day for the rest of your life. We're talking about a few treatments and then you never see the problem again.
That's
all right. Why is this good for cellular regeneration?
Yeah, so all of our devices have this capability of regenerating to a certain degree. But without cellular regeneration, we have to realize our body will fall apart. So our cells are constantly regenerating. But in the presence of infection, disease, chronic inflammation, the body starts to experience breakdown. So microcurrent will remove this inflammation, but it also has the capability to repair damaged tissue. And we see this with wound healing a lot, you know, diabetic foot ulcers. So even these severe wounds can be healed. But what this shows us is that we can remove the pain in the form of the inflammation, but we can also enhance the repair as well. And this device includes modes specific to each tissue type: tendons, ligaments, soft tissue, you know, nerves. And these modes are automatic, but they include these specific frequencies that have been shown to trigger regeneration of this particular specific type of tissue. So really, while our other devices kind of take a broad approach, the Pinnacle can be precise. You can say, I know I have neuropathy, so I can use this device on my neuropathy and I can restore damaged nerves. Or I know that I've got a torn muscle, and same thing, you can restore that muscle while managing the pain at the same time. So this regeneration component is huge, because if we don't regenerate, the cells die and then they contribute to further disease. It's kind of a horrible cycle.
Yeah. Okay, oh, this is what you were saying, different tissues.
Yeah.
Maybe it may be worth making the point, Rob, that, you know, in conventional medicine, all they do is deal with averages. You're in pain, everybody get, you know, you get an aspirin or you get an opioid of some kind. What we're saying here is that you need a different electrical approach to muscle that would work on bone or on blood vessels. It would be different to what would work on a joint. So we're being much more precise than so-called scientific medicine, you know, which just kind of lobs a grenade into the telephone exchange. There's a big explosion and no more pain, no more complaints, but not really a solution, of course.
Yeah, no, absolutely. And I think you hit the nail on the head there. Being precise is important. The body knows what these frequencies mean. And if you give them these frequencies, the body is going to respond by triggering Mother Nature's healing. You know, This is getting the right signal.
Right. Only makes sense, doesn't it, really? Yeah, now this is put in to make the point that it can integrate with other systems. So you could use, if you're an acupuncturist or a therapist or specialist, or you know this model, you can make them work together, can't you, Rob? How do you do that?
Yeah, so there's a pen probe, which I actually do have. There's a pen probe that is not a needle, so it allows you to do needle-free acupuncture. So you can locate these acupuncture points and you can stimulate them with the specific frequencies to those meridians. So if you're either an amateur, you're kind of getting into this, you want to learn, we have some basic training, but otherwise professionals will use these devices to replace needle acupuncture. And they find that they get better or the same results.
So it's but a much less brutal way of doing it. Yes.
Yeah.
Okay. Next. Oh, sorry. I forgot to.
Oh,
this
is
fine. What you were saying. Yeah, it was.
Yeah.
Sorry. Yeah. Okay. So what about this?
Oh, this is the big one with this device compared to any of the other ones. Is using the onboard technology here. And you see there's a screen. You can see that on the picture. There's a little screen there. This allows you to analyze your body's tissue in 2 seconds. You touch the device to the skin and it's going to give you a number. And that number, we teach you what they mean. And I'll show it here. It's really basic. They're either going to be less than 25, between 25 and 35, or over 35. This allows us to determine whether we're dealing with degeneration, normal tissue, or inflammation. And because this is so fast, you can start at one point and you can check down your arm, for example, and you can say, this is where the real problem is. I've got lots of inflammation here. So even though it's hurting up here, you know, I can find this spot and I can go in, and you know how to deal with it because the numbers tell you, are you having breakdown there? Are you having inflammation, or is it normal? So we know what we need to do to treat. And I think on the next slide, I have a good example of this.
Yeah. Yes. Yeah. Perfect.
Yeah. So this is an example here. If you're thinking like chronic ankle pain, in the picture, the inflamed red area is where your pain is. This is where it's hurting. And without the ability to evaluate, the gut reaction often will be, let me treat the area that hurts. Sometimes, however, that doesn't resolve the problem. I'm not saying it never does. But sometimes the issue is elsewhere. So by taking these diagnostic readings, we can actually determine the true source of the pain by searching for inflammation. So bearing in mind, these 3 points would have taken 6 seconds to get these readings on. So point A, the actual point of pain, shows up as a 39, which is inflamed. That's above 35. Point B, though, shows up as a 52, which is extremely inflamed. And point C shows up as a 27, which is normal. So we then know that, look, this 52, this point B further up the leg is actually contributing to the pain that you are experiencing. So we can go in and we can treat point B. And in treating point B, we'll relieve or eliminate the pain in point A. So it's something you can't do without this ability to evaluate.
Yeah, brilliant. It is the most brilliant aspect without question. Yeah, so here's another sort of crossover model. Some people love chakras, the chakra model, and work with it. Yeah, am I right, Rob? I think there's a frequency for each, characteristic of each chakra.
There is, yeah. And we have very long trainings on the chakras, taking them out of the spiritual side of things. There's a physical energy core in these areas, like the throat chakra is right near the thyroid. So people end up having a lot of physical and emotional problems connected to these. And there is a specific frequency to each. So there's 7 chakra modes in the pinnacle. And realistically, like if you want to learn about it, like you're going to get access to the education. There's about an hour and a half presentation going through all of them and picking out which chakra might be a problem for you or how to work systemically through all of them. But it is a totally optional modality, just like the meridian stimulation.
Right. This might be a good point to first introduce, Rob, the fact that if you get one of these devices, there's hundreds of hours of, instructional videos that you can access will teach you almost anything, from tooth pain to fixing tonsillitis to infertility to boosting your immune system if you've got cancer. And, there's lots and lots and lots of training videos. We'll come to that later anyway, but it's always good to know. You're not just, you don't just get one of these, shell out the money, get one, and then it's like, duh, what do I do?
No.
There are seriously good online classes that are available to you. Now, there is a little cosmetic benefit. This is where I like to have your mum on the call, but you'll have to take over. Come on.
Yeah. So microcurrent is quite well known, even though it's not been for a very long time. It's been used for cosmetic purposes, but it's quite well known as a cosmetic treatment. And while our devices are designed more for pain, for inflammation, for chronic disease, we did include 4 basic programs that are for facelift, and they're very excellent programs. You've got 2 for the face, 2 for around the eyes, and they'll actually be providing what my mom Laurie calls a cellular makeover. You're not just working on smoothing the wrinkles out, you're actually improving the cell structure, you're building fat cells, you're tightening and repairing muscles. You're going to get a lasting change. It's definitely better than Botox. You'll get a younger looking face. It's kind of a bonus we throw in here with the pinnacle. You can do all of this pain stuff, and then you can do the facelift as well if you want to.
Right. I mean, beauty is really about how you hold your face. I saw this once when I was a med student. They had this beautiful woman brought in on a trolley, and she was going to have an operation. They gave her the pre-med and then anesthetized her, and it all went blur. She just looked like a blob of lard. But when she came round, a muscle tone regrouped everything, and she looked absolutely beautiful. I've always remembered that case for that reason. And of course, we can go further. We don't have to just tone up the face. You can tone up the body and do good things lower down. So
yeah, that's right. One of the most common things for this, I'll say, is that final point there, abdominal separation. Was it diathesis?
Diathesis. Yes.
Thank you. Yeah.
Diathesis. Yes.
Yeah, I always stumble over that one. Women love this for repairing this. Sports injuries, post-surgical recovery. The device can be used to actually stimulate exercise. Or simulate exercise.
Simulate it, yeah.
Yeah, you'll actually feel like you're getting a workout. I had John once hooked my arm up during a training video, and my arm was so tired after 30 minutes because it was just engaging all of those muscle groups as if I was lifting weights. It was exhausting, but you can build up to it, and you can, especially for people on bed rest who have injury, this is a great way to maintain muscle tone and strengthen muscle tone as well.
Right. This is where I wished we had your mum on, because, the obvious question I'd ask her with her female skills as well as Avazia skills, would it help with pelvic floor? Lack of tone, do you know if you got any cases like that, Rob?
Yeah, so we have had quite a few. When we deal with pelvic floor issues or even prolapses, this is one of the main treatments that we might be looking at. You can do it externally. We also do have insertable vaginal electrodes. which are used for this as well. So we usually use kind of a two-pronged approach with it. We go
literally
with the
two-pronged.
literally two. Well, it's one pronged, but you can do we do kind of put pads over on the abdomen in the right spot, and we can stimulate it that way. But we have options for all of those things. Yes,
that would be of great interest to my people who is an older group, and let's face it, over 50 is older with women. You know, if you've been through childbirth, the troubles with incontinence and difficulty controlling your pelvic floor, it starts early, and it just, you know, it only gets worse. But listen, us guys too, this has been known since the Russians first developed this device back in the 80s, that it will also reduce benign prostatic enlargement. I don't say I'd recommend it for, you know, prostatic cancer. That's not what I'm saying. But, you know, the aging process where your prostate swells, and that's what causes you to get up in the night and you have to suddenly urgently go for a pee. Listen, you guys know you know exactly what I'm talking about. You can sit on a pad. You could use that probe, shove it up your north end looking south, but you could actually just sit on a pad. It's much more comfortable. And I think the girls could do the same thing, couldn't they?
They could, yeah.
Yeah. Okay, let's move on. Damping. Now, this is a very important part of the capabilities of this device.
It is, yeah. And I want to introduce these topics because I think this means we're leading into talking about all of the new modes in the Pinnacle. And I'm going to use these terms a lot. So it's good to understand what they mean. Damping simply means depth. You know, there's a lot of stuff that the engineers rename, or maybe it is named that way in electricity from an engineer perspective. But when we add damping to a mode, what it's allowing us to do is to push the current deeper into the body to reach root issues. So deep scar tissue, deep nerve damage. Without it, we're very surface based and we're kind of just treating within a couple of inches of the body. But if we need to get 6, 7, 8 inches in, we need more damping. Variable damping is essentially, it's a variant of the same thing, but it's adjusting. So instead of just pushing it down to a certain level, it's going to different levels all the time. So it's making sure it hits all the different areas. And then pulses, these control how fast the frequencies fire. So how quickly they're moving through. Is it going to just stay 1 for 10 seconds, or is it going to go 1, 2, 3, 4, 5, 6, 7 and bump up as it goes? Pulses, increasing the pulses gets the attention of the body faster. So it actually means a reduction in treatment time and enables a seamless transition between high and low frequencies. So with the right pulses we've added, we're able to drop from 1,000 hertz to 2 hertz, and you don't even feel the change in your body. So even though you're going from a stronger frequency to a really low one, your treatment is consistent throughout.
Right. And let me say, folks, this is light years ahead of anything that's available. Light years. Anyway, you promised us some new modalities.
Yeah.
It does all those brilliant things, and then it does even more.
That's right. Yeah. Everything we've talked about up to this point was available in the Pro Sport 3 as well. So now everything else is a bonus on top of this. So we were able to add 12 additional programs, and we've kind of built these to fit the needs of the patients that we work with on a daily basis. And these modes are meant to both simplify and perfect treatment modalities. For a lot of people, and I said in this, when we created this slide, because it was so new, I can say now for sure, people have found that they've replaced a lot of their day-to-day therapies with these new modes. Many of these programs are designed to treat specific tissue types or injury types, and they automatically treat with seamless sensation. They let you know when cycles are complete. You'll find that this speeds up your treatment times as well. And originally, our internal test was so successful that Avazia employees started using our device instead of theirs at home as well. They just uploaded them into their machines.
Yeah, nice point. All right, Bio 2, what's that?
Yeah, so we're not allowed, so we have to be careful what we name things. Otherwise, I would have just named this nerves. But, you know, this is what the FDA will allow us to name it. So this is healing body, this is Bio, 2 hertz. So this works with a wide range of frequencies. This is the example I gave a second ago. It goes as low as 2 hertz and as high as 1,000 hertz, and it's seamless transition and sensation. This one is meant for nerve pain, neuropathy, issues with nerves. And this mode works to restore sensation to nerves. So if you've got that kind of numbing and the pain of neuropathy, it'll also enhance circulation, which is crucial. You need more blood flow in there, reduce burning nerve pain, and then drop all the way down and regenerate nerves with 2 hertz. And this is one of the modes that's an automatic feature, the automatic treatment. This means that it's going to track progress as to how many times you've cycled through, and it will tell you at the end of each cycle, treatment complete, cycles 1. And you can do, typically we recommend between 1 to 3 cycles, which will take you up to 18 minutes and as low as 6 minutes to solve the issue.
Right. Now, one of the most terrible pains that people suffer from, I mean, regional pain syndrome is pretty bad, but the worst, I think, is trigeminal neuralgia. You had success with that? It's pretty awful.
Yes, it's pretty awful pain, absolutely. And it does come down to, with trigeminal neuralgia, we often start with a very low frequency to get the nerves used to it because they're so highly sensitive to pain. Then we can move on to a powerful mode like Sanabio 2 after a couple of days.
Right, great. All right, 24, so 24 hertz, yeah?
Yeah, 24 hertz, you got it. We figured out the pattern. So this is essentially for arthritis. Joints respond incredibly well to 24 hertz. So designed with arthritic pain in mind, we start at about 150 hertz to reduce inflammation. And then we very rapidly switch it over to 24 hertz to take full advantage of the inflammation being turned off so that we can start to repair. This is one of the modes that has randomized pulses and variable damping so that we can get deeper into the body and get attention of the body quickly. So this also, as all of these modes do, I'll stop repeating myself here, they retain this seamless transition so you don't feel the drop between modes. But you're really just working to reduce inflammation, and then you're addressing joint damage and swelling. And this is also an automatic mode that will tell you when it's done.
Right. Now, this is all so dazzling. Folks begin to see why I call this a hospital in your hand. My goodness, it can do everything, anything. It's brilliant. But I've got to emphasize, and Rob will help me emphasize, that you are trained. We teach you how to do this. You don't have to come to it as an intuitive wizard or a top chiro already. You need not know how to switch the machine on when you buy it. But we'll teach you how to, and you build it up. You build up the levels of your skills, and it won't take very long before your people are seeking you out, actually, because they want the relief, for goodness sake. Okay, Sanabio 14.
14 is for muscles, so it's actually 13.6, but it didn't look quite so nice as an unrounded number, but it is 13.6 in there, and it is meant for muscles. So again, we have to follow this basic pattern, basic yet complex, of reducing or eliminating inflammation, enhancing circulation, triggering regeneration. We need that oxygen that comes with the new blood flow if we really want to heal. But we can't get that there if there's inflammation. And then we want to work with the body to say, repair this. And this is all done very rapidly because we are, with all these modes, we're taking advantage of every split second. So from inflammation's gone, we don't have to then alter our modes, place them back on the body. It changes for you. So it starts doing the next thing it needs to do immediately. So every little bit of time is really working here. We've seen reduction of treatment times from 30 to 40 minutes to 6 because this mode just does that rapid change. So it's really sped things up while still getting the results that we're looking for. But if you have any muscle injuries, torn muscles, this is the mode to go with. And it's also an automatic treatment mode.
Right. Now, Rob, we've had people with us quite a while now, well over an hour. Can we just speed it up a bit with these? This is good for muscles.
I'll hit them what they're for. Yeah, absolutely.
Yeah, without missing anything out, but just be as brief as you can.
Yeah, so this one is for tendons. So it's the same thing as the other ones, but it works on tendons and ligaments at 9.6 hertz, still automatic, and still has that seamless transition in it.
Good.
7. This is your bone one. Bones, fractures, cartilage, loss. This is the frequency you want to use for this one. Again, same thing, right? It's just working on bones specifically.
Right. And the pain one.
Pain one. This is my favorite one. And I'll speak a little bit more about this one. This one is quite unique because often when we're dealing with pain and inflammation, we don't have the ability to also repair things because we're working so hard on this. And what this does is this does anti-inflammatory, and then it drops down to as low as 0.5 hertz, like really, really low. Which is a very good broad regenerative frequency. So you're taking full advantage of getting the pain gone now in the moment and working on regenerating at the same time. So this is your go-to for any kind of chronic pain.
Right. Wonderful. This one?
This one's John's wound healing protocol. So Dr. Hashay's wound healing protocol. I didn't think we would use this one as much, but this one started to be used in even in a hospital setting for treating diabetic foot ulcers and things like that by doctors, because you can get such a heavy amount out of this. This is kind of his automatic treatment that he did from his study, anti-inflammatory, heavy emphasis on circulation, and then a big boost of ATP regeneration in there as well.
Wow. Miraculous stuff, Rob.
This one is our Sanacycle, is a basic you don't know what to do mode. If you have no idea what you're doing and someone says to you, I don't feel good, you can use Sanacycle on the area. It follows the basic rules of microcurrent, clears scar tissue, does anti-inflammatory, and tries to stimulate some regeneration, though it's not super specific. It's another one of the automatic modes as well.
Right. Trauma. You mean physical trauma, really, not my daddy used to abuse me trauma.
That's right. Yeah. So if you have an injury within the first 48 hours, you don't want to shut off the inflammation because that inflammation is part of the healing process. But you also don't want to be in pain. This skirts anti-inflammatory while working a lot of regeneration and just really works well to reduce that initial bruising and eliminate that pain without taking away from the body's attempts to heal in that initial treatment window. It also tells you when it's done as well.
Mm-hmm. Good.
This one, Surf 350. This one's for surface tissue.
Was that a Beach Boys song?
It sounds like it, doesn't it? This one's used specifically for keloid scars and really heavy scarring. If you've got like adhesions, this is the kind of way to go here. 350 hertz is perfect for flattening this out. This is not an automatic treatment though. This is a consistent one. You could use this for a much longer period of time. It's not going to tell you treatment's done. You'll know though, just from the kind of release that you will feel.
Yep.
Deep 77 is a scar tissue mode pushed deeper. This has got a lot of that damping I talked about. So when we're treating a scar from say a cat scratch, we use our regular scar mode. But if you're dealing with, deep scar tissue within the body, then you want to use Sana Deep 77 because it pushes things deeper in.
Right. I should say to people, you might have people there, well, I don't have any scars, but you do. You know, if you had your tonsils out or a dental extraction, you've got scars. So don't forget, it's a very widespread phenomenon. Soft T. Okay.
Soft T. Yes. So this is for soft tissue. This is I think the final of the new modes, and it works at about 90 hertz. And this is something we've been using for years, but been having to hard program in every single time because it doesn't exist in any of the microcurrent devices we've used without programming it in. But this is the frequency for regeneration of soft tissue. So when people are dealing with like liver problems or kidney problems or pancreatic problems, we can use this to help regenerate organs as well as to help stimulate soft tissue. And it is used like in so many of our microcurrent protocols because we work on so many of these referred areas that we're really happy to have given it its own mode. It does have the ability to take those readings and evaluate, as well as having extra damping for depth, because of course we need to get deeper in if we want to help regenerate organ function.
Right. Okay, well, I'm cringing now because I think this thing is going to cost about $15,000 or $20,000. If it does all that, it's worth $50,000 to be honest. But anyway, it isn't. It's very affordable, isn't it? Let's go through what's available. If you want to buy a kit, well, you don't just buy the device. Or at least I mean, you can, but it's not the smart way to do it. The smart way is to get all the extras, like probes. There's the Y probe in the middle there, look, which is 2 electrodes like that. Stick that on your vagus nerve or on anything else. Trust us through the bits, Rob. You're more familiar with them than me. There's a comb there. It's great for animals.
Yeah, that's great for animals. There's so many things in here. We've tried to put as much value as we could in it. The Y electrode, as you mentioned, vagus nerve, and really just even for extra reach, being able to treat your own back or down your legs without bending into an uncomfortable position. It's excellent for that. There's some ear clips, which we talked about for the neurofeedback portion of things. We have a variety of different conductive pads. Some are used for just positioning for pain. We have a vagus nerve conductive pad, which is used directly on the vagus nerve, as well as trigeminal nerve pads, which we used for our PTSD and depression protocols. This kit also includes a face electrode for the cosmetic treatments, as well as a tongue stimulator, which is used for treating either dental issues or for working on people that have traumatic brain injuries or are having issues with long COVID. We use the tongue stimulation there to help with the brain dysfunction. And then you get these gloves and socks, which are actually threaded with some silver thread, so they're conductive. And they're used to actually increase mitochondria production in the body. So you get all of these different things, as well as a manual. There's a printed version of the manual that's included in this as well. And you get all the wires you'll need to make use of the kit.
Right. So people who get this device signed up in a membership program to explain that. That sounds exciting. Yeah. This is where all the training takes place. Yeah, you can go physically, but there's so much online training.
That's right. Yeah. And so our video library is constantly growing. I do about 30 videos every 3 months, so 10 videos a month. We currently have over 250 videos. This slide it's changed a little since then. So you get access to these videos. You can go in, you can type in arthritis or Parkinson's, and up pops a video you can watch. And 5 to 10 minutes later, you're going to know how to use your device to treat this condition. So it's a constant reference point. We even have it on an app on your phone. So if you need to pull it up while you're on the road, you can do that. Unlimited treatment coordinator support. So this is for professionals and home users. We have a treatment coordinator team that's actually growing again because we've got so many people that they're working with. But the treatment coordinators provide you with one-on-one support. And this is huge because you're gonna want to be able to ask questions. You're gonna want to be able to customize your treatment plan to you, get that personal advice, hop on Zoom with someone and say, am I putting my Y probe in the right place for the vagus nerve? That's what this team is for. You also get access to the private Facebook group, so you can kind of collab with other people, ask us questions in there as well. I do live training courses where I do 1 to 1.5 hour courses on in-depth training topics that people have asked for. And we bring John out, we dust him off, Dr. Hashe, and we sit him next to me, and we do an hour Q&A every month where people can hammer him and I with questions and put us on the spot. There's a lot more as well, but those are the main features that are included in this.
Well, that's pretty damn stunning anyway. Oh yes, approvals, FDA approved. So these are very important to some people.
Yeah, they are. So we are FDA approved, Health Canada approved, CE certified, and as of last week, we are also TGA approved in Australia. So I think we now have approval everywhere in the world. It's for different things. You know, in America, we're approved for chronic pain. In Canada, we're approved for chronic pain, as well as blood circulation, regeneration, things like that. In Europe, we're approved for that, and vagus nerve, and neurofeedback, and brain work. And the joke I always tell people is, you know, obviously biologically, we're different depending on where we are in the world, and that's why they've decided these things. But you make the connection for yourself. the things we can do in other places versus the things we can do in some, but we still teach everyone equally how they can use these devices. And as you say, some people find these approvals very important.
Yeah, for credibility. But I mean, doctors often do. It's called off-label prescribing, and they use it for something totally different to what it's supposed to be used for. It's common, so I don't think any authorities are going to mind if you do a bit of off-label prescribing. You know, if you use, you know, you're in the US and you use this to treat your tonsillitis, it clears up. That's maybe not strictly what they mean by pain treatment. Actually, if you've had tonsillitis, it most certainly is. It's horribly painful.
It is horrible, yeah.
Anyway, so where are we going here? All right, so guarantee, that's important, yes.
Yep. So within 30 days of receiving the equipment, if you're unhappy with it, you can let us know you want to return it. There is a restocking fee, which just goes into essentially replacing some of the parts to make the device new again, because as medical equipment, we can't resell used equipment. But yeah, you have 30 days from when you receive it. And it's important to me I put that point out there, because if you're in Australia, it might take you a week to receive it. And then, you know, maybe you're going to feel that that's going to eat into your time, but it's from the date that it arrives with you. Yeah,
nothing. Yes, fair enough. Very fair. All right. So let's talk about this. What are we going to spend?
Yes.
And you've got a big bonus running here, haven't you, as well?
Yes,
yeah?
We do. We got two offers here. So first off, you can get these offers on our store, but through the /KSM link. So it's, as you see in the top left, thesanashop.com/KSM.
Maybe we should have said www.thesanashop. We mean a web address there. Okay.
Correct. Yes.
I mean, if you type that in, it'll work, but it's actually a worldwide web address, www.thesanashop.com/KSM.
That's right.
And you have to put that in uppercase or capital letters, otherwise it won't work.
Perfect.
Sorry, didn't mean to.
No, it's important information. It is. Now we have these devices are available. We have them ready to ship. I know at the time we did the previous recording, they were on pre-order, but they are now available. They've been circulating since the end of last year. So no worries about delivery times. We have two offers for you here. So the first offer is on the left. This is to purchase the Avazia Life Pinnacle Deluxe Kit at its regular price of $4,995 and to receive a Scalar Chi device for free. These are usually $1,400. So we're giving you a $1,400 item there. The Scalar Chi, I'll have to explain what that does. It plugs into your Pinnacle and it converts the electricity into a scalar wave. Now, a scalar wave is a regenerative modality. I've got a Scalar Chi here, actually, that bypasses clothing. You can treat anywhere on your body. And essentially what it does is it provides a cellular reset. So if your cells are clumped, if there's a bunch of health issues going on, there's chaos in your body, this turns the frequencies of your body down to near zero and allows your body to kind of recover from whatever is going on with that chaos. It's like when your computer is super slow and you do a restart and then it starts to pick up again. It's shut down a lot of those background programs. That's what you get from the Scalar. On the other end, and this is usually our most popular offer, you can get the Avazia Life Pinnacle Deluxe Kit and get a free lifetime membership to our training. This includes the one-on-one support that I talked about. It includes the training video access. We usually sell a lifetime access to this for $2,000. So you get that for free. If you
get some free anyway, don't you? You better clarify that, Rob.
Yeah.
You were just saying, you get access to all these videos and the Facebook group and so on. That lasts for a limited period of time. I mean, long enough, but it comes to an end eventually. Most people, I think, would prefer to have the lifetime of training and knowledge.
Yeah, you do get, if you go with the other option, if you're not getting the free lifetime membership, you still get 60 days access for free. So 2 months from the day you activate it. And that's a lot of time in there, a lot of time to do things. But the lifetime access means, if a health problem, you've solved your health problem, something comes up in 6-9 months time, you just get back on the phone with your treatment coordinator and it's like nothing ever happened. They're there to help you from the get-go again. So those are both of our options there. Both of these are the full kit that we just described all the contents of as well.
Okay. So I guess we're pretty near the end here. Do we have a final resting place? Oh yeah. So we're gonna go on to Q&A now, and except that every time I seem to fluff it. But anyway, in theory, I'm going to leave this screen up. And that's the address where you go to make a purchase. And by the way, Rob will be there later answering questions. That there's a chat box on that website. If you want to ask more questions to be really clear in your mind before you buy one, then go ahead. Let's now take a look at, it says Q&A, but I usually start with the chats. Shall we do that together? Rob?
Okay, I'm pulling
which way, where's the beginning? Oh, can't, yeah, so that's the beginning, can't hear.
I think we're starting.
Can't hear at all, low, can't focus, can't hear either, do a screen, little sound. Oh, okay.
I think we're down around the 10:30 mark with Marge.
Yeah, around here. All right, what about just above that? I can only state at 11, you need to be more direct. Listen, we went as fast as we can through a mountain of information, Stuart. People need to know these things. It's no trivial matter to get involved in this. It's a lot of money. I mean, I'm not saying it's not worth it, but you need to be committed that this is what you want, and you want to be a miracle healer using this device. So I'm sorry if we've lost you, Stuart. So let's start with Matthew then. I don't usually read out surnames. There's a degree of anonymity.
I agree.
Right. I can't remember if you could drill down a bit. Yes, no, it's the same for you, Matthew. We did our best to get it all in. This is not a toss it off, fly by night sales pitch. This is a whole new medical paradigm that needs to be understood, and it's miraculous. All right, Rob. Right, if Rob's on Vancouver Island, how does he sell them here or give workshops on the island? Well, first of all, there's workshops anywhere. You don't go to Europe and you don't go to China anymore. I mean, John used to go to Malaysia, didn't he, and travel the world.
Yep.
But these days of internet, you can do anything anyway. You just get on a Zoom call with anybody and you can talk, you can visualize, they can show you the settings. I don't think that's a problem really, Marge.
Yeah, no, we actually ship from here on Vancouver Island. So if you're on Vancouver Island, you get them pretty quick if that's where you are.
Oh yeah, and it's worth making the point. If you try and buy one of these in the USA, you can't. They're going to insist on a doctor's prescription. Try getting a prescription for one of these out of a conventional doctor. But buying them from Rob Direct in Canada, you bypass all that. It's quite legal. Been selling them for 20 years. And there is no problem with importation or anything like that. Right, Pete wants to know about cervical pinch nerves, this horrible thing. Mm-hmm. Sometimes you turn your, at our age, Rob, you turn your head a bit quick and you kind of pinch your nerve and it hurts for the rest of the day. And sometimes, of course, it's worse than that.
Right, yeah, absolutely. I mean, I'll try and be pretty brief while being as detailed as I can be. But, you'd be able to work, particularly with the Y electrode, directly on the area to kind of release the pinched nerves. And yeah, it's definitely going to be a fairly easy with one of the automatic treatment modes. There's probably 2 I would try for it because people tend to respond differently. But you would be able to release some of that and it should really help. Great.
Yes. Okay, Julie. Rife, it's nothing like, even vaguely like Rife technology, Julie. Spooky too. It's kind of a joke, really.
It's really different. Like you're getting that when we talked about conversing with the brain, right? Getting that level of talking with the brain. That's something that you're getting from this. And my thing with Rife is always Rife is about killing. You are looking to isolate a pathogen and kill it. Microcurrent is about working with your body to build its health up. So there's not really any similarities at all there.
Okay, John. Spooky too. Do you want to? Oh, did we?
Yeah, just about autism.
Oh, I didn't see. Oh, yeah, you're right. Yeah. Maybe yeah. Okay, it has come up before, hasn't it? And you can do a lot.
Has. Yeah. Yeah, and I mean, my son is autistic. He's 11, and I use it to help him manage his condition. Primarily vagus nerve stimulation I find to be huge because there's a lot of hyperactive nervous system, a lot of sensitivities, and it's definitely something that we've been using and seen others use. Absolutely.
Right. Okay, so we'll pass Julie's question and go back to John. Can you use this while using a grounding sheet? You might need to explain quickly what that is for others and then answer the question.
Yeah, so the grounding sheets they're like what people put on their beds to essentially simulate earthing. And if that's correct, then yes, you absolutely can. There's no reason why you couldn't use it together.
Right. Now, what about the cancer question? This always comes up.
It does always
quite rightly, can you use it safely? Well, you wouldn't use it on a cancer tumor to try and reduce the tumor because it will create blood flow, and that's the last thing you want. But if it tones up the immune system and does all the other good things, then it's got tremendous benefit, hasn't it? I mean, if it's only extending survival.
Yeah, vagus nerve stimulation becomes a big part of that. Building up cellular energy becomes a big part of that. And really, if you're looking at treating cancer, like you do want to stay away, as Keith says, from treating the tumors directly with microcurrent, but you may want to look into the scalar option because scalar energy has been shown to help quite a bit with cancer. And it doesn't have the same level of circulation enhancement, Julie.
Right. Okay. Matthew wants to know, well, he wants us to talk. We could go on all night about inflammation, autism, and gut dysbiosis. I suggest, Matthew, actually, that you go over to the Sana shop there and start a chat with Rob, and maybe not tonight. He's going to be very busy, or today, I should say. It's my night time, but it's in the morning for Rob. He's going to be pretty busy for the day, but maybe if you call him up tomorrow or use the, it's the chat box. If you want to do an email as well, send it to me and we'll forward it. Bit too deep for tossing off quickly with a large audience here, still a very large audience. Any success with AMD, age-related macular degeneration, and or underactive thyroid? They're separate conditions.
Separate conditions, but yes to both. We do work with AMD a lot. Really circulation. We treat it kind of like scarred, break up the drusen in the eyes. But really AMD is just lack of circulation to your eyes. And so when you start to use microcurrent, you'll see up to a 450% increase in blood flow and circulation. So people often are able to reverse their AMD. For underactive thyroid, we have the thyroid is sort of like a no zone with microcurrent just because it is so, what's the word John uses? It's easy to flip one way or the other. So we don't want to stimulate it too much, but we do work around it to quite good effect there as well.
Okay, good. Julia, she's still suffering with COVID toes after a year now. And obviously she's got a Pinnacle, not sure what mode to use. Do you want to defer that one for a teaching class later, or just give her a quick answer now?
Yeah, Julia, I would say, if you're not using Sana IP, that will be the one I would start using. But if you want to send me an email, then I can absolutely kind of create something a little bit more personalized for you.
Yeah, good idea. Marge is saying, is the price on the island? I presume she means Vancouver Island. $5,000 US, and the answer is yes. You're not getting it any cheaper, my dear.
That's right. Yeah,
that's not fair to other people then if we try and do that and cut deals.
Yeah, it is $5,000 US. The store now lets you pay in your currency. So if you're in Australia or Canada, it'll convert it, but it's based on the conversion of $5,000 US.
Right. Okay, David. How is MC? We didn't touch this actually in this set of slides, but it's a very important question. Why is it different from TENS? They are worlds apart, but you need to understand how.
Yeah, so a TENS device is really like blocking pain. That's what it's there for. It puts so much electricity into nerves that you don't feel the pain. It numbs the nerves, so you're no longer feeling the pain. With microcurrent, we're using body-friendly frequencies to actually stimulate the body to do what we want it to do, to resolve the issue. From a mechanical standpoint, a TENS device is 1,000 times more electricity at its lowest level than microcurrent is at its highest. So you're doing a lot of current into there. And I have worked with people in the past that have done things with TENS devices that they shouldn't have done, like try to stimulate their vagus nerve, and caused themselves actually brain problems that lasted 9 months. There's a lot of stuff you can't do with TENS that you can do with microcurrent.
Yeah. Okay. Matthew, seems like you need all the tools along with a lifetime of support. Is there a price for both? Well, run over it again. I thought we made that clear, but run over that again. What do you get for what?
So you get, if you get all of the tools in that kit, you can choose the lifetime support option there. And so you're getting that $2,000 support for free. So that's just at the $49.95. That would be my recommendation there, Matthew. I think it's going to be the most popular option for sure.
And you still get you get the whole kit anyway. You get all those extras, the probes, you get all of those anyway, either deal, but you get the lifetime support if that's what you're looking for.
That's right.
That would be the one, wouldn't it? Do you sell these on a payment plan? This is Alva. We don't actually technically and fully, but in principle, we're not against it, are we? I think, Alva, you should approach again, it's not something we want to discuss in public with you. We're nice, friendly people. Well, the hashes, I'm nice and friendly, but I don't sell these things. It's the hashes that do. I'm sure they can come up with a deal that might work for you. The trouble is, I've got to tell you, Alvis, that when people do a plan, you get the first payment out of them, and then they never seem to want to pay the rest. So, don't expect that people are going to be glowing with happiness and delight that you want to plan, but also don't expect to get rejected, because it's, we don't do things like that. Right, vagus nerve stimulation, decrease the incidence of seizures. Well, that's a loaded question. Are we talking epilepsy, David, or some other kind of pathology?
Yeah, it's kind of tricky, because you say it does depend on the reason for the seizures. In some cases, yes, absolutely, I've seen it. And then when it's epilepsy specifically, interestingly enough, like vagus nerve implants are done to treat epilepsy in the States quite a lot. So there's definitely a lot of potential there. But if it's from something else, we have to just be careful as to where it's coming from.
If the person has a brain tumor, for example, that could cause seizures, but we're not saying that we can fix a brain tumor with this and the seizures will go away. That would be wrong. Yeah. Okay, Joan, what is the PMP to the UK? Well, you might have to do a ballpark here, Rob, because I know you don't package and posting. We call it S&H, shipping and handling. Yeah.
Okay. Yeah. So it's actually fixed. Anything outside of North America is $90. It goes UPS, and we put a lower value on the package so that you don't get hit with such high VAT. Usually, I think we can put, instead of the 5,000, we can put as low as 1,000, which certainly helps reduce your VAT, which I think is close to 20%. We do that for everyone, whether it's the UK or whether it's Australia. It's all kind of covered under that same cost. It takes roughly 7 days to arrive, 7 business days through UPS.
Right. Okay, David, same David, I think, wants to know about using MCT for decreasing intestinal inflammation and creating intestinal regeneration. He doesn't mention a condition, but we'll be talking about Crohn's, ulcerative colitis, a dysbiosis to some degree. And the answers are resounding yes, isn't it, Rob? I know that.
Absolutely. Yeah. Vagus nerve stimulation, you're going to go there. That's part. I worked with quite a few people in my dissertation study on that, those particular issues. Vagus nerve stimulation is huge. But then when you break beyond that barrier as well, using some of the pinnacle modes like Sana IP, which is designed to heal wounds like these ulcers and stuff over the gut directly, you're going to get to double up on that effect.
Right. Okay, good. Stephen wants to know, how can I use this device to improve my heart function from a low of 25% and shortness of breath? Also, he's got a PSA, that's the prostate specific antigen, around 69, which is horrible, John, Stephen. But can be fixed. I mean, you need to take a very broad view, and you probably need to eat a lot better than you are, doing a little bit of exercise, gradually building it up, as well as what the microcurrent therapy can do for you. But this is going to help, isn't it, Rob?
It is, yeah. Treating the heart directly, provided you don't have a pacemaker, with this soft tissue mode is going to really help there. Vagus nerve on the right side, which is a bit of an abnormal vagus nerve approach, actually also affects the heart. So there's some good combinations of things you can do that the treatment coordinator team will be able to set up in a private plan for you.
Right. Now, the raised PSA, you're playing a gambling game. That's between you and your doctor, really. Most doctors would say, well, you need to have that have you got a prostate cancer? Even if you have, that's no reason to panic and have surgery, and we can probably help hold that back anyway. Oh, here we are, clarification from David. He meant seizures in an autistic child. So still a yes.
Oh, yeah. And I see as well, he's also said GI issues related to autism as well. Yeah. So like from this perspective, it should not be a problem. It should actually help to reduce things. Yes, David.
Right. And the fact that you use it with your own family, I think that's quite telling too. Applicable to migraines and mitral valve prolapse. I'm not sure about the second one. Migraine's good.
Yeah, definitely good for migraines. I'm also not 100% sure about the mitral valve prolapse. Migraines is almost like a 100% success. Just vagus nerve alone can turn those off and stop them coming back.
Right. I mean, mitral valve is really a plumbing job, and we couldn't be rather rash and say, oh yes, easy peasy.
Yeah, no, definitely not. But something that we could work on for sure, but it would definitely come down to a customized treatment plan.
Right. Can you treat stage 3 CKD? Gosh, you and Americans and your abbreviations. Anyways, chronic kidney disease.
Yeah.
And stage 3 isn't quite as bad as it gets. There's a stage 4.
There is.
But it's bad. So what do we do? Soft tissue?
Yeah, soft tissue in there for sure. We have a full protocol for what we call acute renal insufficiency. And that is it's considered one of our emergency protocols. So even when it gets to stage 4, that would be what I would follow for sure. We have videos on that and everything. The Pinnacle is the perfect device because, as Keith says, soft tissue mode is important there.
Yeah. Okay. What about intermittent hypertension?
Yeah. It would. Yes, definitely. Took me a second to translate hypertension in my head, but yeah, no, absolutely.
Well, intermittent's very unusual. It means you don't have blood pressure, really. If it goes up sometimes, hell, if I watch some of the news broadcasts, my blood pressure would skyrocket. But that's not the same as having hypertension, is it?
No.
You might need to see that as a different disease process, really. Okay, folks, I'm going to definitively stop on the chat, and we're going to switch to Q&A. There's a lot of people there been patiently waiting. They want an answer to their question. Will it be recorded? Yes, it is. Is it good for varicose veins in the calf muscle area?
We do have a varicose veins protocol that Laurie put together, yes. So that is not.
Well, a straight yes. Okay, Barbara, is this effective for lumbar disc prolapse with nerve root pressure or with Parkinson's disease? Well, it's two very different answers. So.
Yeah. So I will say definitely yes to the first one. And then we do have a Parkinson's disease protocol. And while I know Laurie and John have had a few outright successes where the person just seems to have been, completely fixed. We have a lot of success in managing the symptoms of Parkinson's and really helping with it. So it's a yes to both. It's just more of a direct yes to the first one.
Yeah. Okay. Rashid, hi there, brother. Is there a way to evaluate the status of our inflammation state? Well, the evaluation function will take you a long way down that road, Rashid. Do you want to just, in one sentence, trot it out again, Rob?
That may have come up. Question may have come up before we got that far in, but yeah.
Oh yeah, that's true. Yeah.
With the screen, definitely, you'd be able to use that to determine where the inflammation is. If you're looking for full-on body inflammation and you're like, what, I think I've got it body-wide, we always look to the gut. And so that would be kind of your mapping place. See if there's high inflammation there, because that's going to spread pretty heavily. But yeah, you'll be able to use the device itself to monitor your progress in reducing your inflammation throughout your body.
Okay, good answer. All right, now Alva's got a very complicated. Well, we'll take a crack at it, but it might be one of those it's best to deal with in yours and hers own time. But she's having trouble. She's taking steroids, and the main side effect, as you know, taking steroids is you put weight on, all in the wrong place. You get a big fat belly and skinny arms and legs and so on. But she's taking 5 milligrams a day, which is a lot. Energy levels are non-existent. Well, that would be because of suppressing the natural adrenal steroids. And she says boobs, belly, and bum have become fat-laden, which will not shift. Now my legs are weak. And I'm wondering if she might have a condition called lipedema here. Alva, if you have, type it in a bit lower down. It's a different problem, very serious and difficult problem too. More likely, though, just related to a side effect of the prednisolone. I don't know why you're taking it, but it may be that microcurrent therapy will help you reduce or get rid of altogether the need to take steroids, which is not a good long-term medicine. It's very destructive. Don't want to worry you. But anyway, if you want to go deeper, maybe start with an email. Okay, so Raymond. Yeah, I think we said this too. The body's inflammation, it's the body's response. Yes, short term. That's what the body does. It fixes it, heals it, then done. It's when it won't go away and it becomes chronic inflammation that it's so destructive. Oh God, have I done it again? I always hit the wrong thing and blow
You
that.
said you were going to, and you did, so.
Well, it just shows you how clever I am. I know what's coming. Oh, there we are. Oh, that was easy. I just hit the back button. Can it be used to heal AFib issues with one's heart?
We do have an AFib protocol, yes.
Right. I would obviously consider other things like chemical toxins and overload. Food allergies, it's one of the very common, so you need to take a broader look. But microcurrent certainly help you with that too. Raymond again, can it be used to heal insomnia issues? Oh, yes.
Yep, depends on the time. Like we always kind of break it down into two levels. Is your insomnia because you can't, is it you have a hard time going to sleep or a hard time staying to sleep or both? That tells us whether we need to work with alpha or delta waves, but the answer is a yes to both.
Right, great. Barbara wants to know, is it effective for osteoporosis? Well, not if you keep doing all the wrong things nutritionally, but will it help a bit here, Rob?
Yeah, it can, especially with the bone mode. It can help, but as you say, like there's a nutritional level to that which can't be fixed.
You can't be circumnavigated. You've got to take on board the nutrition. The doctors say take calcium. It's disastrous. Magnesium would be better, but the number one nutrient you need, sweet, is boron. B-O-R-O-N. Boron, 3 milligrams a day. It was first discovered to be useful for hardening bone by a doctor in Northern England, Yorkshire. But he found 2 cases. These are in Australia, where the orthopedic surgeons had 2 cases where the saws wouldn't cut the bone. The bone was so hard that their electric saw just wouldn't touch it. And the answer to what the hell's going on, why are these bones so hard, was boron. I say no more. Right, so Raymond again. All right, so he's suffering from Guillain-Barré from a vaccine. Of course, that's usually where it comes from. Well, he's recovered pretty much. He still is numb, without a B, numb from the knees down. Would it restore nerves in the lower leg?
Yeah, that new nerve mode, Sanabio 2, is amazing for the restoration of sensation there. So it would definitely help a lot.
Right. Okay, good. Dale, can this device be used with people who have implants? Implants of what, of course? She said maybe hip or knee implants or aortic valve implants, all of the answers are slightly different for each.
They are, barring anything electronic, yes. So like, if you've got like a hip replacement or knee replacement, absolutely. If you've had a valve replacement and it's not mechanical, absolutely. Realistically, the only one that really worries me a lot is an implant. Like you already have a vagus nerve stimulator there. Do you really want to keep stimulating it again? Or you have a pacemaker. Even in those cases, we work around them and it's fine. But you wouldn't want to work directly over something like that. But everything else is good.
All right, let's repeat the link for those of you still lingering. It's still, well, yeah, dozens of people on the call. It's www.thesanashop. It doesn't matter whether you use capitals or not. thesanashop.com/, and then it matters. It's got to be capital K, capital S, and capital M. No prize for guessing that's me or my initials. So we answered Dale. No, Raymond again. Come on, you want your money's worth, don't you, Raymond? Can it restore a hypothyroid functioning? Well, again, not in the absence of proper nutritional, your iodine and iron. You need to know what you're doing, but it can help dramatically, can't it?
It can, yeah. We do have a protocol for it, again, but as Keith said, you have to be doing the right things as well.
Right. Now, Rashid, does this work to restore hair in men? I'm going to show you the answer silently. If it did, I'd have a crop of hair. Sorry. Actually, I suppose I should throw it open to Rob. That's not fair.
Oh, it's,
has it recovered hair for some people?
Yeah. In some people, like I always find it's 50-50. Like some people are like, yeah, this is starting to work really well. And then other people like it did nothing. It seems to depend on why. Like, is there a genetic factor to it? Is it scar tissue? Like, what was it that caused the hair loss? And so it is totally different for everyone. My honest answer on that.
Right. Okay, now I've just noticed that you've put the link in the chat, actually. So those of you who've still got the chat open, you can click on the link there, thesanashop.com/KSM. Raymond, again, we're not paying him to ask questions, He's got a lady friend at church who suffers from fibromyalgia pain throughout her body. Would this help? Yes.
Yep.
A big yes. Randy, can it treat I don't think that was the same person that asked the question before, was it? Was it a Randy? Will it treat stage 3 chronic kidney disease? Yeah, yes. Helpful. There are protocols. I've lost my cursor. Oh, there it is. Raymond again, another lady friend. You've been hobnobbing with all the ladies at your church, Raymond.
Netting in the abdomen, adhesions. Yeah,
oh, yeah,
okay.
Yeah. No, it will help clean up the mess, but the surgeon's going to have to take the mess out. She's got mess in there. It's nothing's ever going to heal with foreign bodies in place.
Yeah.
Right, Raymond, again. Can this unit be used to treat infected teeth instead of having to remove the teeth?
We do have, we've had people that have done that. My one caveat with teeth is that it does take a little bit of time. You can't expect, with some of this stuff, you can treat your elbow and it's just going to flip around and feel better the next day. With teeth, you can be looking at a couple of months, really, if it's a really chronic issue. But we have absolutely had people do that and have success with it. And the tongue stimulator tool in the kit is useful for teeth problems, because you can put it, I've actually got one here, you can bend it and put it right in the mouth and rest it on the gums, and it's not metal, so you don't get any extra conductivity with the wet mouth. Okay,
good. Now somebody called George. He's just joined. It's a bit late. Will there be a replay? Yes, and you're going to absolutely love it, George. We will post everybody who registered with the link for a replay, which we'd like you to share with your friends as well. I hope you found this an absolutely stunning event. Can it be used for eye issues, cataracts, glaucoma? Rob, I think I'd like you to tell them about the goggles, and that this may be an upcoming, yeah?
Yeah, so we have a special attachment for eyes, and pretty much if it's an eye condition, we can do something for it with microcurrent. We use the microcurrent goggles for this. We are working with Keith to put together a specific eye event in the coming months on this, and we'll be talking all about eyes in that as well. The goggles are a bit hard to come by at the moment, so that's being part of the issue. You can treat the eyes directly with the probes and stuff, but it's not as effective as using the goggles, which treats the eyes, both eyes, all the way around them and on the eye at the same time.
Yeah, great. Very useful. All right, somebody anonymous wants to treat skin cancer. Don't really recommend that, but he's been using BEC5 cream, which is very good for basal cell carcinoma. It's very effective, but as he says in complaints, it does leave or may leave unsightly scars. Still wouldn't recommend it, would you, Rob?
No,
For
not
skin
necessarily.
cancer. I mean, you know, I might go to the regional lymph nodes and get them, you know, recruited and work on, you know, spleen and other tissues that might become a workforce in battling with the skin cancer. But
I will say, and I always forget this because we don't usually talk about this on these presentations, but if you were to use the scalar, you would probably, the scalar cheat, you would probably find some benefit from that as well, without leaving these scars. But yeah, to treat directly, I would agree. I would concur with Keith that we'd just be best to avoid directly microcurrenting over that.
right. So Jerry is, oh, it's a very long question, Jerry, and it's getting late. You know, we're coming up to the sort of 2-hour mark, I think. No disrespect. I don't mean we don't want to answer it. We promise. But it's such a long and complex question. Do you mind going direct? Either just copy this chat request or question, I should say. No, it's not a chat. It's in the Q&A. Copy it into an email and send it to me in answer to one of my, I will forward it to Rob, who will answer you, I'm sure, within 2 or 3 days. But remember, it's going to be hugely overloaded over the weekend with people asking lots of questions. Can you see this question, Rob?
Which one is it? The long one from
Jerry Diekman.
Yeah, so Jerry, if you want to send that on to me, because I'm not quite sure how to process that question on this call.
Yeah, it's too long. It's too long, and the average person is going to get lost. Alva had kidney transplant, hence the medications. Okay, can MCT reduce tinnitus?
That's another one. Like that's another hair loss question. It's 50-50. We have about 7 to 8 different things that we can try to deal with tinnitus, and if one of them works for you, great. If not, you know, that's just the luck of the draw, unfortunately. If I can find a definitive solution to tinnitus, I would probably be able to retire today with how often I get asked that question.
Yeah, John, this is a sad story. His daughter did a face plant, had smashed up the front of her space and damaged her teeth. Oh my goodness. She's going to need reconstructive cosmetic repair, you know, some very good and very skilled repair, but we can help speed up the recovery process dramatically. I mean, we haven't got any of those kind of pictures, have we? But again, if you want to write into us, we can send you a bunch of before and after emails of people who really got messed up, but then ended up healing off quite well. You know, there are some remarkably good. I mean, we've got pictures, we haven't got it in this particular slideshow, but somebody had frostbite of the toes and was going to lose them. They're probably going to have the foot off. It's certainly going to have toes removed. All recovered. 10 days later, the guy was back to normal. Toes recovered. He actually jogged around to John Hachet's home and said, "Hey, take a look at this. It's fixed." It can be that dramatic. Yeah. Another anonymous one, will it? I don't think the person wants to be anonymous. It's just that they don't know how to change the name settings. Heart and arteries, do you have a program for hypertension? Well, I think I've said that. What about sleep? If a person's sleep's been... Listen, this is 3 or 4 questions we've already answered, actually, anonymous. Do you want to add anything to what we've said here?
I think, you know, realistically, yes to most of these questions. You know, there's obviously an entrainment issue when you're trying to reverse flipped sleep. But it's possible, absolutely.
All right. Now, a strange question. I think we'd be light with this one. Pete wants to know if you can add more programs to extend the therapy. Listen, you've got an absolute miracle. You've got a hospital in your hand. What the hell do you want? A chain of hospitals in your hand?
Well, I'll throw out, you know, it is programmable. You have space to build and save 4 programs, or just make programs in the moment if you want to. So if you really feel that there's more, like we used to use that all the time, you don't need that feature as much anymore. But if something comes up, you absolutely can build and save your own programs in there.
Right. Okay.
Cool little bonus.
Yeah. Now, Barbara says, right, you know, big thanks to you and me. Linda, will this video be available for my doctor to see? It will be available if you can drag your doctor to see it. Good luck with that, darling. Walter, does it help with allergies? Yes.
Yeah, definitely. Got some pretty extensive allergy programs. Many of them work on the gut. Surprise, surprise. But that will help, absolutely.
I've done it again. Crap. All right, Dale, what about dental metal caps, crowns, implants? Well, it's saying, will the device work? Well, it won't fit a crown for you and it won't do tooth implants for you. Do you mean healing the damage or the pain from suffering teeth that may then not need that work? Or are you saying, oh, by the way, I just realized I'm going a bit dark. The sun has long set here in the south of France. Anyway, you can still see me. Toenail fungus. What about that one? That's a bummer, isn't it?
That's a bummer. Yeah. Some of this comes down to, with fungal issues, adjusting the body to make it resistant to these foreign bodies. Unfortunately, fungus can be, it's not like as responsive to pH as, say, parasites. So when we normalize your pH, certain fungi continue to grow anyway. But there's some body-wide approaches I would take to see if they would work. It's just, it does seem to depend again on the individual issue.
Right. Okay. Now, a strange one from John T. Can you suggest a fee to charge someone who needs repeat treatment?
Sure.
Well, just toss off a number and let's move on.
Like usually people charge $125 an hour when they're kind of novices at this. If you got other qualifications as well, I see people charging upwards of $400 an hour. Just depends on what you're offering.
Okay, good. All right, so I'm shutting down the Q&A. Thank you. Back to some chats. Jerry says, can I get a deal? I presume he means some kind of saving on the device if I already have most of the attachments. Yes, what's the basic price for just the Pinnacle without any of the kit?
Just the Pinnacle without any of the kit is $4,500. You know, we could probably, as part of this webinar, come up with something to do with the lifetime training or extra training or something to add on to that for you, Jerry, as well. Okay, so you have to message us privately.
Yeah, yes, or go to the shop and start a chat, which will get answered sooner or later. So Stephen has a 2000 blue scanner, a Cosmetic from 2010, and a Scalar laser. How would I benefit from your device? Well, you could throw all the others in the trash for a start, or sell them, and just use this. It does everything those do and a lot more.
Yeah, I think, realistically, specifically, I don't know too much about the Cosmetic. When it comes to laser, I find that 100% of the time, microcurrent works better than laser. Laser being frequency medicine that goes in a straight line and doesn't travel through nerves and do all of that stuff. Microcurrent has that benefit to go beyond that. And this device is a cut above what the blue scanner was. As Keith will remember, we used to do that rhythm scanner some 15 years ago now, before we got this better American-made technology that just really allowed us to customize what we want to do and how we want to treat.
Right. Okay. So somebody's asked for the email. I'm going to type that in. Why don't you just tackle one of those questions there, like assisting? Well, we've dealt with hair growth, but anyway, just talk among yourselves. Sure. While I type this in. This is. Send it to me and we will forward it to Rob. So
I'll say, Julie, when it comes to these COVID losses, like sense of smell and taste or hair, we actually find that it's an issue that seems to be corrected when we stimulate the tongue. The nerves in the tongue will actually hit the brain and you can start to kind of repair what's going on in the brain there. This is where we've seen a lot of turnaround from these issues, is just doing that brain stimulation. And then I think this wasn't even so much a question, was just mentioning that the kidney transplants resulted in the steroid being taken daily.
Yes, as well as yes. So you probably think it's unlikely to get off them, but I wouldn't. I'd be very hopeful if it were me personally. But there are issues. Of course, you've got to stop the unpleasant response of the immune system. Folks, it's been a wonderful evening. We've talked our head off. The irony is, Rob and I came to this thinking we were going to have an easy time and just start a video from last time playing into the Zoom webinar. Didn't happen. So you got a sudden off-the-cuff live webinar, and I'm really feeling it. It's bedtime
for
is
you.
beyond where I am. Yeah. Not that it's too late not to have a glass of wine or a glass of champagne or something and then go to sleep. All right. So there is one more question there. Joan is saying thanks to both. Julie had a beamer that helped a lot, but not enough. Oh, can you explain the difference? Well, I think tailor making the transformations is the key thing, isn't it? A beamer will throw out a signal, and certainly if you get lucky and use the right SIP frequency at the right time, you'll get an effect. But if you want to talk directly to your body, you talk through the brain. These Avazia devices are really unbeatable. Absolutely.
It's a big difference. As Keith said, PEMFs like the beamer, they don't initiate contact with the brain. They add frequencies in and they hope the brain takes notice. You get this kind of like lightning fast response where with the microcurrent, where the brain just says, oh, okay, and it makes those changes. So I think that's the major difference there. And you know, that's what you'll see if you decide to go ahead with this. That's what you'll see the difference to be. It's just getting those precision results from working with the body and the brain at the same time.
Right. Okay, folks, any other questions, please forward them. Use my wife Vivian's email address. I've just typed it in the chat for you earlier on. If you just email her. I'm sorry, I just realized forget that. It's Scott Mumby Wellness at gmail.com. Scott Mumby Wellness at gmail.com. Yeah, there we go. Okay.
Perfect.
So any other questions, send them there. We will deal with them. I won't. I'm going to bed unashamedly. I'm going to have a glass of wine, a hug with my beautiful wife, and I'm signing off. I'll be around answering emails tomorrow, and we're back to normal on Monday morning. Thanks all for coming. Thank you a million, Rob, and for coping with a sudden being pitched into a live webinar instead of an easy watch, you know, just doing the Q&A bit at the end. That's what we thought, isn't it?
Yeah.
Okay,
absolutely.
so let me stop the share. So there we go. There's a whole list of chats. And I'm going to end now. Okay, lots of love to everybody. Take care.
Night, Keith.
Bye.